Hello everyone, I'm going to be taking you through part 1 of our group presentation. So I am in group 4. We're going to be talking about heart failure and heart valve disease today. Alright, so the pathophysiology. So with heart failure, the heart may not be able to adequately provide tissue with the amount of blood it needs. That's going to be a metabolic issue. This condition can result from systolic or diastolic issues. So on the systolic side, the heart cannot pump blood hard enough. Usually it's due to weakened heart muscles. They're not going to be able to squeeze as hard as they need to. On the diastolic side, not enough blood is going to fill the ventricles. So stiffened heart muscles will not be able to relax, causing less blood to be able to fill the ventricle. And then congestion or fluid buildup is a concern of these conditions, as blood will back up into the lungs, causing congestive heart failure. So for the physiology, we need to know some of these key words. So cardiac contractility is just going to be the force and velocity of the contractions, so how strong and how quick they are. Cardiac output is going to be the product of stroke volume and heart rate. Preload is going to be the loading of the heart between the end of the relaxation and filling phase, and then just before the contraction. And then afterload is going to be the force-resisting myocardial fiber contraction, and that's going to be at the start of the systole. So the Frank-Starling principle is going to be going to test the heart's function. So that top line is that normal line. That's normal conditions, just a normal heart. That's how well it's going to perform. But with a heart failure, it's going to drop all the way down to that very bottom line that's red and jagged. That's going to be where the heart's going to go down function-wise, so it's not going to function as well. But with treatment, performance of the heart can actually be sustained to a point where it can function. We just can't get it back up to that very top line, that normal line. So some signs, symptoms, and causes. Some signs, shortness of breath with everyday activities. So if you go out to the mailbox just to pick up the paper or something, and you're out of breath, that may be an issue. Swelling in legs, feet, and ankles. You'll have a dry hacking cough that just doesn't want to go away. Rapid weight gain, possibly feeling tired all the time, and high blood pressure. Some causes: it usually develops after other conditions have already damaged the heart. In some cases, the heart doesn't have to be weakened for this to occur. It can just be a byproduct of tissue around the heart becoming stiff. Over time, the heart can't keep up the demands required to keep blood flowing to the rest of the body, and because it's overworking so much, the heart may potentially enlarge as well. Treatment-wise, there are some self-care things you can do. So physical exercise is one, and that'll actually lead into the second point, which is weight loss. You can go on a low-sodium diet, and if smoking is in the history of the patient, you can have them quit smoking as well. For medications, you can prescribe a diuretic. It's going to eliminate extra water from the body. Beta blockers slow heart rate, and they're going to decrease blood pressure. ACE inhibitors are going to relax blood vessels to lower blood pressure. And a vasodilator is going to widen blood vessels. So in some cases, the tissues of the heart and blood vessels need to be strengthened back up instead of relaxed. So you'll give them a blood pressure supporter, and it may be prescribed so that they can increase blood pressure when it is too low. So Diane is our case study client. She's a 59-year-old female who was diagnosed with heart failure on the left side of her heart. She has known about the condition for about 2 months, and her treatment has included the use of Servadilol, a beta blocker, and furosemide, which is a diuretic. She does not smoke. She does walk a little bit at work, but no other physical activity. She's 5'5", 161 pounds. We do not know her body fat percentage. She's got a 132/84 resting blood pressure. Her heart rate is 81 beats per minute, but has not went through any previous exercising test. And then her goal is she wants to begin strength training, and she's also interested in cycling as well, so some really good cardio. So the plan is to have her on an exercise regimen 2 to 3 days a week, especially so she can keep up with her grandchildren.